Are all addictions the same? Are they all genetically determined? And how do we do a better job with it?
Well, I think that there is a genetic background that predisposes a given individual to all of the above, and that possibly in the realm of science, when we're able to draw blood and understand someone's genome, we may be better able to predict and counsel them that the wisest thing they could do is avoid any of the potential addictions. And abstinence is a great approach prior to the addiction. And I think that my definition of addiction, which would be any repetitive behavior that continues despite harmful consequences to the individual, does qualify for an addiction. And I stated it like I did purposefully because that includes behavioral addictions, which of course are more and more prominent in society these days.
Let's say that there's someone in a family that has an addiction. It's not common for people to, you take your kid to the doctor these days, the pediatrician, for a regular checkup. They'll ask, in America, are there guns in the house? Do you strap your child into a car seat every time you get out? Is there anyone smoking? But they never ask about, is there any history of addiction in the family? Should they?
I think that would be a great approach. And I think, waiting until an addiction medicine person asks that same question is probably too late, because if you're in front of somebody like that, you've already had and expressed your predilection for addiction. And so possibly investigating in a more pediatric sense would be a really good idea. I think the behavior is what eventually determines the addiction, because if you have the predilection, but for instance, don't come into contact with opioids because you have a sprained ankle, you're probably not, you may not become addicted to opioids. But if you have that predilection, then I think you're at greater risk. But in passing, most of us have not been taught to pursue that line of questioning when you're doing a history.
That's interesting. I'm intrigued about that, because if there's a strong genetic determinant, we know of the damage that addictions do to individuals, and we have access to children, in the United States, in the United Kingdom, kids go for regular checkups, and we talk about preventative healthcare. We talk about obesity. We talk about so many, but we don't talk about this.